Dr. Owais Durrani. Good morning, Doc. Nice to see you. So tell us, what is this sudden unexplained death that can happen with adults, apparently?
Yeah, good to be with you. So I would say in the medical world, we call it a diagnosis of exclusion. So if someone is young and healthy and they pass away and an autopsy is done and we rule out every other thing that, possibly could have led to a cardiac arrest or death and we don't find anything, then a lot of times it is labeled as that. I would say in about half the cases, if you do what we call like a molecular autopsy, so go beyond like the normal autopsy and look at genetic causes and whatnot, usually there's some type of cardiac issue that is identified, not a structural issue, but an issue with the electrical systems and pumps of the heart, essentially.
Dr. Durrani, do you typically see some kind of underlying factor in the body with these cases?
So no, not usually. So usually if you were to get like an echocardiogram, which is like a picture of the heart, the chambers, the sizes of the walls, everything would look normal. The most common way it's identified in living people is usually you will have a relative, like a first-degree cousin or an uncle or someone who dies unexplained at a young age. And so then what happens is the family becomes worried. You go see a doctor, they may get an EKG, and that is something that could tip you off to, hey, there's an abnormality here, let's get a further workup, and usually you'll get genetic testing in that case as well.
Wow. Dr. Durrani, how common or uncommon is this with adults in America?
Yeah, so I would say it's not very common at all. There's about 100 deaths per 100,000 people. So it's not completely like impossible or, unheard of, but it's also fairly rare. It is one of those things. I'm an emergency medicine physician, and anytime anyone comes in for like lightheadedness or chest pain or trouble breathing, the thing that every single one of those patients gets is an EKG. And that's the reason for it. There's certain things that we can identify on an EKG that would clue us in towards, hey, maybe this patient has one of these genetic abnormalities leading to a potential fatal heart rhythm. And so then we can kind of get the cardiologist involved, get more testing and see if they really have it or not.
Wow, this is really scary. I mean, when we look at pictures of Ana Walshe, she's young and vibrant, 39 years old, beautiful. She's at a healthy weight. It's hard to think that this woman could die suddenly and unexplainably. But it sounds like what you're saying, Dr. Durrani, is that this can happen.
Yes, yeah, I would say it can happen. It's not frequent, it's not common. The average, 30 or 40 or 20-year-old listening to this, it's probably not going to happen to you. Usually, like I kind of mentioned, it is something that is genetic. And so usually you have like a parent who maybe had a family member who, died unexplainably, and their, kind of red flag is up, and they're probably going to get their kids genetically tested early, or maybe it happened to them and thankfully they didn't pass away and they got the treatment for it. And for a lot of these things, you can be put on a medication, or in certain cases, you get a defibrillator and you live a totally normal, healthy life. So it's possible, but it's definitely not common. I don't want to scare people to think this is going to happen to them or anything like that.
No, we appreciate it, Doc. We appreciate your honesty. So for anybody watching this program who might have unfortunately had the awful experience of losing a relative unexplainably at a young, healthy age, and they were told by the doctors, yeah, it's this sudden unexplained death. What advice would you have for those relatives in terms of what they need to ask their doctors about in order to make sure they're covering their bases, so to speak?
Yeah, absolutely. And prevention is the number one thing, the most important thing. So I would go to a primary care doctor, and usually, a family will see the same primary care doctor, which is good, right? So I would, as a family, go to the primary care doctor, kind of mention what happened to them. In that case, usually they will get an EKG and kind of look for those signs of abnormalities. If those exist, what they'll likely do is get the cardiologist involved, and then they do a variety of other tests, like an EKG, a stress test where you get on a treadmill and you're hooked hooked up to an EKG. They may get some imaging of the heart, and then they may do some genetic testing as well to see if kind of the markers for something like one of these things. There's a variety of them. One of them is like called Brugada. One of them is called long QT syndrome. They'll kind of look for those things and see if they exist. And if they do, like I mentioned, these are things that we have treatments for. And so usually you'll get those treatments and live a long, healthy life.
Yes, that is the hope. Boy, this is fascinating insight that you're sharing with us. Thank you so much, Dr. Owais Durrani. We really appreciate you. I would love to have you back sometime soon.